Shenzhen Rising Medical, Rising Band Radial Artery Hemostasis Compression Device. Rising band is used for hemostasis after radial artery catheterization. The components of the rising band include the main body of the rising band and an inflating syringe. Before the surgery, it is necessary to carefully observe the puncture site and exclude the presence of hematoma. First, pull the sheath of the catheter inserted into the blood vessel outwards by 2 to 3 centimeters, and confirm that the patient's arm does not have vascular spasm. Wipe and disinfect the puncture site and surrounding tissue with sterile gauze, and completely dry the puncture site and surrounding tissue. Align the center of the airbag pad with the insertion site of the sheath or the puncture site of the blood vessel, and install the rising band. After installation, check its tightness. If the belt can be inserted between the belt and the skin of the operator's index finger, the tightness is appropriate. Remove the inflation valve plug and use the inflation syringe to inflate the airbag pad through the inflation tube until sufficient pressure is generated. The initial pressure is generally 15 to 20 milliliters of air injected into the syringe, which should be adjusted according to the thickness of the patient's arm. Generally speaking, if it is difficult to inflate the airbag pad, check whether the fixing strap is too tight. If the airbag pad is fully inflated but still cannot generate sufficient pressure, check whether the fixing strap is too loose. The standard for adjusting the air pressure is: 1. Check whether there is radial artery pulsation at the proximal and distal ends of the radial artery puncture site. 2. The incision does not bleed. 3. Confirm whether the ulnar artery still has pulsation. The next step is to slowly and completely withdraw the sheath. After withdrawing the sheath, adjust the pressure again according to the previous standard. Record the time of radial artery compression hemostasis. 1 to 2 hours later, use the inflation syringe to extract 7 to 9 milliliters of air and observe whether the incision bleeds. Under the maintenance of the compression force, compress again for 1 to 2 hours. 1 to 2 hours later, extract all the air inside the airbag. Observe whether the incision is not bleeding, and continue to observe for 15 minutes with the hemostatic belt at 0 pressure. After 15 minutes, remove the hemostatic belt and apply an infusion patch to complete hemostasis.